my foot hurts. So I got some pain right there. And now there's always factors that can lead to pain that just randomly shows up. In this case, probably these Metcons that I'm wearing are about 6 years old, and so they don't have the most support anymore. And I could definitely start doing some exercises that I will start doing to strengthen up this area. So that's all fine and good, but it won't produce results right away, even though it's probably the most effective way to make sure it doesn't come back. But in the meantime, I've got patients to see. I'm lifting at the Atlantic Cup on Saturday, so I need some way to help it as it heals. So what we're going to do is tape it. This is tough skin. I don't need to ask myself if I have allergies against skin adherence, because I know myself. But if this was a patient, I would obviously have to ask. Just makes the skin a little stickier. The tape we're going to use is called Leukotape, but I have to put this on over it first, because Leukotape is extremely sticky, and I don't want to cause any more skin irritation than I need to. So I'm going to cut that. So my suspicion, based on the pain that I have, it's right behind a bone called my cuboid, which is right here. There's ligaments connecting that to this bone. So this tape is going to be rigid, provide some support, and will keep me able to do what I'm doing while I do the necessary exercises to heal. If it would not do that. So this goes on first. So I could tape right over this right now, but just to make sure it stays, because this tape can stay for a while, we're just gonna spray it again. So I don't need to do a lot. I'm just gonna do a few strips that will kind of give a bit of extra support to that bone. Now, taping yourself, if you're an athletic therapist or physio and you've had to tape yourself, you know it sometimes is an interesting series of movements, much different than taping another person. So I'm going to make sure that I'm right over that bone and start to apply a bit of pressure. We're going to do 2. Okay, so it's just